I'm Dr. Jonathan Fielding. I'm the Director of Public Health and Health Officer for Los Angeles County. Thank you very much for being here. In terms of flu, this year is different because the flu season has really never ended. We've had H1N1 flu throughout the summer, and the degree to which we've had it is unusual. We've had, up to this point, 157 known hospitalizations associated with this, and 25 regrettable deaths from H1N1 to this point. We would expect some increase in the flu starting when school starts, and that means we'll probably have more hospitalizations and, unfortunately, probably more deaths. The flu vaccine situation will also be different this year, because there will be two vaccines. There will be the seasonal vaccine that has 3 different components. That's the same kind of thing you get every year. And there will be a separate H1N1 vaccine. The seasonal vaccine should be available within the next month or so through the usual sources of care, through physicians, through pharmacies, and in some cases through workplaces. The best information to date is that the H1N1 vaccine will start becoming available in mid-October, and they will continue to manufacture it. We don't know exactly how much we'll get, but we know that there's on a compressed schedule to get as much as possible out as quickly as possible. We are working very hard with our key partners, with health plans, with physicians, with pharmacies, with community clinics to make sure that the H1N1 is broadly distributed, because the way that people are going to get H1N1 is through their usual sources of care unless they are uninsured. And the usual sources of care this year, of course, will be physicians, will be health clinics, and in some cases will be pharmacies. So we are working hard to get as many of those signed up as possible. We want every doctor who gets flu vaccine, usually who provides it, to sign up, and we're asking that they sign up at our website, which is publichealth.lacounty.gov. What is different about H1N1 in terms of the vaccine is that the priority groups for immunization are different than for the seasonal vaccine. So for the H1N1, it is, number one, the pregnant women. I'm going to start that again. The priority groups for H1N1 vaccine administration are pregnant women, are caregivers of children less than 6 months of age, are children and young adults 6 months through 24 years, and those 25 through 65 who have conditions that might give them a more severe case or have complications if they were exposed to H1N1. In addition, emergency workers and healthcare workers are part of that priority group. Older people, who account for a vast percentage of the severe cases of complications of seasonal influenza, have some immunity in many cases to this H1N1 because of infections they had with flu as children. So the older adults, which are a prime target for the seasonal flu, are not the prime target for H1N1. Unlike the seasonal flu, the H1N1 vaccine will require 2 administrations, and probably 3 to 4 weeks apart. Public health will have limited administration of the H1N1 vaccine. It will be reserved for those without other sources of care, and we will do that through public health clinics and through points of dispensing, which will be set up in different parts of Los Angeles County. And that information, as it becomes available, will be widely broadcast and will be available, of course, always through our website. The best way to prevent flu, whether it's seasonal flu or H1N1, is to get immunized. So we recommend seasonal vaccine for all those who usually get it, and even more. Basically, everybody is a good candidate to get I'm going to start that again. Everybody is a good candidate for seasonal influenza vaccine, which should become available starting in the next month, and all the priority populations are urged to get the H1N1 vaccine as soon as that becomes available through the usual sources of care. We also are maintaining a stock of antivirals. Those are to be used primarily for those with serious cases who usually would wind up in the hospital or be seen in the hospital, and we are distributing that to and through hospitals, and also to individuals who may be exposed to H1N1 and who have underlying conditions that puts them at higher risk of complications. It's important to remember as we go into this fall season that most respiratory conditions are not flu. And so there are things that we can all do to reduce our risk of getting respiratory infections, including but not limited to flu. One is wash your hands frequently, and wash them with soap and water for at least 20 seconds, which is about the amount of time it takes to sing Happy Birthday twice. Or use the hand sanitizer and use it often. Also, cover your sneeze and cover your cough with a tissue, and then discard the tissue, or if necessary, into your elbow, into your sleeve. You also want to make sure that you don't touch your eyes or your nose or your mouth with your hands, because oftentimes these viruses can be on surfaces like the surface of a desk or a doorknob or a phone, and people don't know it, and the way it gets into the body is through the eyes or the nose or the mouth. And finally, if you're sick, don't go to work. Don't send your child to school if your child is sick. Stay home until at least 24 hours after the fever goes down. Now, you won't in every case have fever, and in those cases you want to wait till the symptoms abate. So see our website, see our YouTube site for continuing information. Again, that's publichealth.lacounty.gov. I'd be happy to answer any questions. Yes?
So, for the seasonal flu, when will the seasonal flu vaccine become available? And does this mean that